Hi, I'm Michelle Thompson. I'm going to be doing a newborn assessment. First, you would start off by looking at the armband of the baby to make sure you got the right one. And it looks like we have RN, NB, and N, which is correct. And then you could start by doing the vital signs. And you would start with the temperature. You put it underneath the armpit of the baby, and it can take quite a while to get the reading. So in the meantime, you can take the respirations by putting your hand over the chest of the baby. And once that's done, you could actually note that. And since this baby doesn't have respiration or an actual temperature, I'm just going to say that I got it and the findings were normal. So then I would discharge this into a trash can, put that aside. Next, you would go to heart rate and respirations, and you would listen for a full minute. And then once you get that finding, you could note that as well. And since it doesn't have a heartbeat, I'm just going to say that it's a normal finding, which would be 100 beats to 160 beats. Temperature would be 97.5 to 99.5. And then respirations, normal ranges are 30 to 60 breaths per minute. And then while I have my stethoscope out and it's a little warm, I'm going to also listen to breath sounds, heart sounds, and bowel sounds. So I'm going to pretend to do that really quick here. And you would do it bilaterally for both breath and heart. So since it doesn't have a heart rate again or any bowel movements on this actual mannequin, I'm just going to say that the findings were normal, the bowels are active, breath sounds are clear. And the baby could potentially have some amniotic fluid still stuck in their lungs, so a few crackles here and there for the first day or so wouldn't be completely abnormal. Next, I'm going to go to the head assessment, so you can cover the baby's body back up and take the cap off. First, you would feel for molding, which is normal. You just got to note it to see if it starts to go away after time. And then you would check the sagittal suture line, which could be overlapping from when it went through the birth canal, or it could be separated about the length of a pencil eraser. Then you would check for a cephalohematoma, which would be kind of a little harder than the caput, and that's actually blood for the cephalohematoma. And it doesn't cross the suture line, so that's one way to differentiate the two. And the other one is a little more squishy. And then you'd also check the anterior fontanelle and the posterior fontanelle. The anterior is larger than the posterior, and it's diamond-shaped. The posterior is triangular-shaped. Then after you're done feeling the head, you could look at the eye placement, and it should be broken down into thirds. So like the spacing between the eyes and both eyes should be 1/3 in equal space each. Then you would check for any discharge and if the folds are normal and normal size. So Asian babies may have a little bit different, a little smaller fold, just because that's what their race looks like, ethnicity looks like. And then you check the ear placement, which should be aligned with the eyes. You would check the recoil on both ear cartilages, which should rebound instantly in a term baby, and it could stay folded for a preterm baby. Next, you check the patency of the nasal cavity by covering one nostril and feeling for the breaths on both sides. And then after that, we can check the mouth of the baby. You gotta put a glove on. You would start by just touching the corner of the baby's mouth until it opens, and then you can stick your finger in gently and feel the palate to make sure that it's even and that there's nothing going on in there that's abnormal. And then you would check their sucking reflex, and unless they're super, super sleepy, then they're gonna have a sucking reflex. And then after you're done with that, you can discard the glove and then check the neck. You would check for any masses or scrapes. You would check range of motion of the neck to make sure they can move side to side and it's not tight on any side. After you're done with that, you're done with the head assessment. So you can put the cap on for now so the baby stays warm. Next, we can move on to the skin assessment, and you can look for any abrasions or scrapes or birthmarks, vernix, a lot of them are normal. They'll go away with time, and a lot of them are just benign and doesn't do anything. You would also look for jaundice, and you can look for it on the forehead, the sclera of the eyes, the chest, the abdomen, or the inner thighs. And then while you're looking at that too, you can also look for signs of respiratory distress, which would be retractions, seesaw respirations, apnea, nasal flaring, or retractions of the chest. And then you can also feel the abdomen to make sure it's soft and not distended. You can check the status of the umbilical cord to see if it's drying or if it has discharge or odor or anything like that, signs of infection. After you're done with the skin assessment and you can say that it's all clear and make any note of any birthmarks, you can do one of the reflex things where I have practiced on myself since the baby doesn't have any joints. You would hold the baby's arm up, extend it back down, and then let go, and the arm should go back up. And that's a good sign for a term baby. And after that, we can look at, what did it do?
It's still going.
We can look at the genitalia, and this is a male baby. In the female baby, you would look to see if the labia majora was covering and prominent to the labia minora and the clitoris. And some discharge is normal as long as it's not really odorous and a large quantity. For the male baby, it doesn't look like this one is circumcised, so we don't have to look for signs of bleeding or infection with that. The scrotum should have good rugae in a term baby, and the urethral opening should be at the tip of the penis, and that is a normal sign. And it doesn't look like the baby voided or had a bowel movement, but you would check to see when they last had one. And even though they didn't have a bowel movement, we would still change the diaper if we actually had a fresh one. And it all looks good down here. No abnormalities there. Okay. Next, we can check the palmar creases and the number of digits. It looks like they have a normal number of digits, 5 on each hand, and it looks like they have good palmar creases, which is another sign of a good term baby. And then we would do the same on the foot and see if they have the 5 toes and the plantar creases. And then after we do that, we would check the Babinski reflex, and you would just take the tip of something dull but a little bit pointed and go in a J-like fashion on the foot of the baby, and it should fan out. And you would do that on both sides. Looks like they would have good reflexes on that. After that, we can turn the baby over to look at its spine and its hips. And you would put your finger down the length of the spine to see if it's straight and aligned. You could check if there's a tuft of hair right at the sacral area or any dimpling, and check to see that the buttocks are aligned and the feet are at equal lengths. That could be a sign of hip displacement or something like that, but it looks like we're good here. And then after that, you would turn the baby back over. And then the last thing would be the Moro reflex. So you would startle a baby, and it should kind of reflex back or make a C with its fingers. And that's a good reflex sign for a term baby as well. They're alert. And any abnormal findings you would have or any findings at all, you could report to your nursing instructor, the mother of the baby, or the nursery nurse or your mentor nurse. And then you would document all your findings in the computer. And you would also just state how the baby did during the assessment, like if they were crying or if they were agitated or things like that, or if they were calm or unresponsive, really. But everything looked like it was normal from what I could actually see, and that is my assessment.